You know how sometimes you hit a really complex topic and well, you want the core understanding without getting totally bogged down.
Yeah, wading through everything.
Exactly. So that's what we're aiming for today. We're doing a focused deep dive into osteosarcoma. It's a type of bone cancer.
Mm-hmm.
Think of this as your streamlined guide, just getting the critical bits about this condition.
Right, and we've gone through some detailed information, the source material, really trying to pull out what's most crucial for you to grasp about osteosarcoma.
Okay, great. So let's unpack this. Osteosarcoma. The description we saw, it suggests it starts off a bit like a normal bone issue, maybe,
Sort of, yeah.
but then it becomes this cancerous tumor that actually makes abnormal bone tissue itself.
That's the key thing, that abnormal bone formation. That's what really defines it.
Okay.
And like the information highlighted, this usually happens in the long bones. Think around the knee area.
Right, the thigh bone, shin bone.
Exactly, the femur and tibia.
Yeah.
And also the upper arm bone, the humerus. Those are really the most common spots.
But not the only ones.
No, not the only ones. It's less common, but the source mentioned it can show up in the jaw, pelvis, even the skull sometimes.
Gotcha. So our mission today really is to give you a solid handle on osteosarcoma. We want to cover, what it is, where it tends to pop up, the signs that might point to it, maybe for potential causes or risk factors.
Yeah, what we know about that.
How doctors figure it out, the diagnosis part, and then the usual ways it's treated, plus some key info on survival rates, all based on the material we reviewed.
Consider it a focused look at the essentials of osteosarcoma.
Perfect.
Sure.
Let's start with those potential warning signs then. What might make someone think, okay, hang on, this needs checking out?
Well, the info points to a few common things. Persistent bone pain, or maybe noticeable swelling in one area that's often a big flag. You might also find it harder to move a joint if it's near the affected bone. Some people feel like a warmth in that spot, or can even feel a lump.
And beyond those sort of more obvious things, are there other clues?
Yes, actually. Things like changes in skin color over the area, maybe a fever you can't explain, and even a bone breaking, a fracture from something that really shouldn't have caused it, that could be significant too.
That's interesting about the pain, though.
Yeah.
I mean, you mentioned it can be really bad, but, well, not always.
Yeah, and that's a really crucial point. Intense pain often is part of it, but sometimes, especially early on, there might not be much pain at all.
So you can't just rely on pain levels.
Exactly. Its absence shouldn't make you ignore other symptoms. That variability, it can sometimes make catching it early a bit tougher.
Right. So moving on to why this happens.
Yeah.
What causes osteosarcoma? Do we have a good handle on that?
The information suggests experts are still really digging into the precise causes. It's not like there's one single thing we can point to,
Right.
But they have identified several factors that might contribute potential links.
Like what? What sort of things increase the risk?
So the material brings up rapid bone growth. That kind of fits with it being more common in younger people during those big growth spurts.
Ah, okay.
Also, previous exposure to radiation therapy is mentioned as a potential factor.
Right.
And interestingly, certain genetic conditions involving specific genes like P53 or RB, these are normally tumor suppressor genes.
Genes that control cell growth.
Yeah, basically. If those aren't working right, it's implicated. And even things like disruptions to the bone's blood supply have been looked at.
And you mentioned the age group. It really does seem to hit a specific demographic, doesn't it? Not usually older folks.
That's right. The primary group is definitely teenagers and young adults, generally, say, between 10 and 25. That lines up with major bone development.
Makes sense.
But it's also important to remember, if someone's had cancer treatment before or maybe has certain pre-existing bone conditions, that can raise the risk in other age groups too.
Okay. So if someone shows up with these kinds of symptoms, or they have some of these risk factors, what's the diagnostic process like? How do doctors confirm if it's osteosarcoma?
Right. So the diagnosis, as it was laid out, it's a careful process, step by step. It usually kicks off with seeing a doctor, obviously, who'll likely order some initial imaging tests.
And those would typically be?
X-rays. That's often the first step. Gives a basic look at the bone.
Okay.
After that, MRI scans are really useful. They give much more detail, especially of the soft tissues around the bone, and help show just how far a potential tumor might extend.
More precise.
Exactly. CT scans might come into play too, maybe more for checking if the cancer has spread elsewhere. Blood tests are also part of the picture.
And a definitive answer.
That comes from a biopsy,
Yeah.
where they take a small sample of the actual bone tissue and look at it under a microscope. That's what confirms it.
And all these tests, they're basically trying to answer two big questions, aren't they?
Precisely. One, is it actually cancer?
Yeah.
And two, if it is, has it spread? Has it metastasized anywhere else? Figuring out the extent, the stage, is absolutely critical for planning the best treatment.
Okay, speaking of treatment,
Yeah.
based on the info we have, what does the typical approach look like for osteosarcoma?
The information suggests a common path often starts with chemotherapy. That's using drugs to target cancer cells, systemically throughout the body.
Yeah, kill off any cells that might be floating around.
Exactly. Then, after that initial chemo phase, surgery usually follows. The main goal there is to physically remove the tumor from the bone.
And is that the end of treatment, or?
Not necessarily. Often, there'll be more chemotherapy after the surgery.
Okay.
Just to kind of mop up any microscopic cells that might still be lingering.
Yeah.
And the info also mentions radiation therapy can be used sometimes in specific situations.
Okay. Now, the surgery itself, removing the tumor,
Mhm.
are there different options there?
Yes, definitely. Limb-sparing surgery is often possible now.
What does that involve?
Basically, they remove the cancerous section of bone, but then replace it with like an artificial joint or maybe a bone graft. The aim is to keep the limb functioning as much as possible.
That sounds ideal if possible.
It is. But the information also points out that sometimes, depending on, how big the tumor is, where exactly it is, amputation might be necessary, or perhaps more complex reconstructive surgery.
These are major treatments, clearly. What about side effects? What potential challenges did the information mention?
Yeah, it's important to know about those. The source listed several potential side effects. Things like low blood cell counts are common.
Which means more fatigue, risk of infection.
Exactly. Mood swings were mentioned, potential fertility issues, which is obviously a big concern for younger patients.
Sure.
Also problems with the mouth and issues related to muscles, bones, joints, or nerves, pain or discomfort there.
Lots to potentially manage.
Definitely. It's crucial for patients to have those conversations about potential side effects when planning treatment.
It sounds like quite the journey. Now, is there anything people can do to prevent osteosarcoma in the first place?
That's always a key question, isn't it? Prevention.
Yeah.
Unfortunately, because we don't know the exact causes, the information suggests there isn't really a known way to completely prevent it right now. However, if someone knows they have a specific genetic risk factor, maybe being extra aware, perhaps talking to their doctor about earlier or more frequent monitoring, that might be an option. But general prevention, not really, based on what we know.
Okay. So let's talk about the outlook. For people diagnosed, what did the information say about survival rates?
Right, the stats. The information gave some important figures. It indicated that, generally speaking, if the osteosarcoma is localized, meaning it hasn't spread from the original bone.
Caught early.
Caught early, exactly. The survival rate is around 70%, which is, relatively good in cancer terms. But, and this is but if the cancer has spread, if it's metastasized.
Then the picture changes.
Yeah. Then the survival rate drops quite a bit, down to about 50%. It really underlines how important finding it before it spreads truly is.
Absolutely critical. So for you listening, if you or someone you know has just been diagnosed, or maybe you're worried about symptoms, what are the key questions you should be asking the doctor?
Yeah.
Based on this source material?
The information actually provided a really helpful checklist. Definitely ask, what specific type of osteosarcoma is it?
Okay.
Has the cancer spread? Where? You need to know the stage. What are all the treatment options for my specific case, not just the first one mentioned?
Good point.
What kind of surgery are you recommending? What does that actually involve? And crucially, what are the potential side effects I need to be aware of for each part of the treatment plan?
Those are such vital questions to get clarity on. And it was good to see the info also mentioned resources for support.
Yes, it mentioned the Indian Cancer Treatment Organization specifically as a place for reliable advice and also information on potentially more affordable treatment options within India. Finding trustworthy information and just support systems, that's incredibly important for patients and their families going through this.
Absolutely. So as we wrap up this deep dive, what are the main things you'd want someone listening to really take away about osteosarcoma?
I think the core points are osteosarcoma is a primary bone cancer, often in specific spots like near the knee or upper arm. Symptoms like bone pain and swelling are common, but watch for other signs too.
Hmm.
Treatment usually involves chemo and surgery, and finding it early before it spreads makes a really big difference to the outcome. Understanding the cancer's grade, how fast it grows, that's also key.
Totally agree. Hopefully, this discussion has given you a clearer, maybe more manageable understanding of osteosarcoma based on the information we went through. It's complex, no doubt, but breaking it down like this, well, we hope it makes it feel a bit less overwhelming.
Indeed. Just getting the basics, the signs, the treatments, why early detection matters, that can really empower you with useful knowledge.
Definitely. And maybe just one final thought to leave you with. Considering how complex cancer is, how it starts, and all the research happening, especially around genetics and these new targeted therapies,
Yeah.
what breakthroughs might we see down the road? What future discoveries could fundamentally change how we treat osteosarcoma and really improve things for people affected by this disease?
Mm.
It's pretty compelling to think about, isn't it?
Yeah.